Female sexual dysfunction, a very important subject. Is it common? Of course it's common. About 40% of women all over the world, they complain of sexual problems. And if we have 40% of women complaining, it does mean we have about 15 to 20% more. They do not complain of having interest of sex or having orgasm or even any satisfaction, any effect in libido. It's a big problem, of course, and it has to be studied well. And it is divided now into three things: either female sexual arousal problems, or female sexual orgasmic problems, or sexual pain, either superficial or deep. It could be primary or secondary from the first time they are exposed to sexual intercourse or after some time of sexual stability. And this is also due to many factors, either social and psychological factors, or due to anatomical factors, or due to problems in the partner itself. Of course, evaluation of this problem needs understanding well and talking with the patient to understand the problem, because if she is having pain, she might refuse to start because she is having pain. If she doesn't reach orgasm or reach any satisfaction, she might refuse because she will think, so what to do after that if I am not satisfied? So we have to discuss well with the patient. Then we have to search. Of course, there is no analysis that can say woman lost interest except in hypothyroidism. This is very important. So we can measure some biochemical studies to assess, but the most important thing is the thyroid function. Of course, in the reproductive age periods, you don't have any problems in estrogen. Of course, we have some problem postnatal because they have some lack of estrogen and some dryness, but still this is all can be solved. Solving of the problem took a long time for discussion between doctors, patients, and scientists, and reached a lot of understanding. Of course, androgens has an effect and leads to increase in libido in the female. Of course, dopamine, serotonin, and adrenaline have an effect in either arousal or in orgasm itself. So also we did understand that's why some drugs, antipsychotic drugs, might decrease interest in sex or leave woman doesn't reach orgasm. So we have to change many drugs also, like antihistaminics, that like contraceptive pills might affect. So we have to stop these drugs. Also, some drugs might help. Of course, androgens, giving androgen is not approved by the FDA, but it is approved in Europe to give little amount of androgen to increase libido. Of course, the phenylbenzene, was proved as antipsychotic drug. Then it is proved to increase sexual function in women, but it has to be taken every night in order to be effective. Also, regarding pain, either is it superficial in the form of such forms, either not decrease libido apart from vaginismus. Vaginismus is a very difficult problem, and it can be solved by giving Botox inside the vagina or vulvodynia, by giving any other drugs in vulvodynia. So this all solved. If deep dyspareunia due to endometriosis and due to pelvic adhesions, also the solution depends upon the extent of the problem, how it is extended, and it can be solved by laparoscopic adhesolysis. So this problem can be solved to some extent if we understood and if we talk well with the patient and her husband, and then we try to discuss the solution, and we might reach a very good solution for such patient if we are all working together. Thank you.